Cervical spondylosis is a common, often age-related condition that affects the bones and tissues in your neck. You may also hear it called neck arthritis or wear and tear arthritis. This condition develops as the discs and joints in the cervical spine, the portion of your spine that makes up your neck, start to degenerate. As these changes progress, they can lead to a range of symptoms like neck pain, stiffness, headaches, and even neurological issues if the spinal cord or nerve roots become compressed. While it is primarily associated with aging, other factors such as genetics, lifestyle, and past injuries can also play a role in its development. The good news is that for many, cervical spondylosis is manageable, and they can live full and active lives. Understanding this condition, its causes, and the multitude of available treatments is the first step toward effective management. This essay aims to shed light on cervical spondylosis, guiding you through its intricacies and empowering you with the knowledge to take control of your spinal health. Your cervical spine is a marvel of engineering. It provides a flexible framework for your head while also safeguarding the delicate spinal cord that runs through it. To understand cervical spondylosis, we must first understand the different components of this structure. The cervical spine consists of 7 vertebrae, stacked one on top of the other. These vertebrae are labeled C1 through C7, with C1 being the closest to the skull and C7 being closest to the thoracic spine. Between each vertebra is an intervertebral disc, a strong yet flexible structure that acts as a shock absorber and allows for movement. These discs have a tough outer layer, the annulus fibrosus, and a soft gel-like center, the nucleus pulposus. Facet joints, located on the sides of each vertebra, are like small hinges that guide and limit the neck's movement. Ligaments act as strong cords connecting the vertebrae and providing stability. Together, these structures allow you to bend your neck forward, backward, sideways, and rotate it. Movements we often take for granted until they become impaired. Cervical spondylosis doesn't happen overnight. It's a gradual process where the biomechanics of your cervical spine change over time. The most common change is disc degeneration, where the discs lose their water content and become less flexible. This process is similar to a jelly donut losing its filling. It becomes flatter and stiffer. As the discs degenerate, they can bulge or herniate, potentially compressing the spinal cord or nerve roots exiting the spine. This compression is what often leads to pain, numbness, or weakness in the neck, arms, or hands. Additionally, the facet joints can wear down, leading to osteoarthritis, bone spurs, and inflammation, further restricting movement and causing pain. Ligaments, the tough tissues holding the vertebrae together, can also thicken and become less elastic in response to the instability caused by disc degeneration. This can further restrict movement and contribute to stiffness. The cumulative effect of these changes can alter the normal curvature of the cervical spine, leading to a stooped posture or the development of a dowager's hump. While age is a primary factor, it's not the only culprit behind cervical spondylosis. Imagine a tapestry woven with various threads, age-related wear and tear, genetics, lifestyle choices, and past injuries all contribute to the intricate pattern of this condition. As we age, the water content in our discs naturally decreases, making them more prone to damage. This process, combined with years of microtrauma from everyday activities, accelerates wear and tear on the spine. However, our genes also play a role, as some individuals are genetically predisposed to developing spinal conditions like cervical spondylosis. Lifestyle factors like poor posture, sedentary habits, obesity, and smoking can hasten disc degeneration and exacerbate symptoms. Moreover, past neck injuries, even seemingly minor ones, can create weak points in the spine, making it more susceptible to spondylosis later in life. Understanding these risk factors is crucial for taking preventive measures and making informed lifestyle choices to protect your spinal health. The good news is that most individuals with cervical spondylosis don't require surgery. Conservative treatment options are often the first line of defense in managing symptoms and improving quality of life. Postural correction, achieved through exercises and ergonomic modifications, can significantly reduce strain on the neck and alleviate pain. Physical therapy plays a vital role in strengthening neck muscles, improving flexibility, and restoring range of motion. Chiropractors can also provide adjustments to realign the spine and reduce nerve compression. Medications, such as over-the-counter pain relievers, muscle relaxants, or prescription-strength anti-inflammatories, can provide temporary pain relief. Heat and cold therapy can be used to soothe muscle spasms and reduce inflammation. Cervical traction, which involves gently stretching the neck, can help relieve nerve compression and pain. Lifestyle modifications such as losing weight, quitting smoking, and engaging in regular low-impact exercise are crucial for long-term management. Additionally, alternative therapies like acupuncture or massage therapy may provide some relief for certain individuals. When conservative treatments fail to provide adequate relief, minimally invasive interventions may be considered. These procedures are often performed on an outpatient basis, meaning you can go home the same day. Trigger point injections involve injecting a local anesthetic and/or steroid medication into specific muscle knots or trigger points that are causing pain. Epidural steroid injections deliver medication directly into the epidural space, the area surrounding the spinal cord, to reduce inflammation and alleviate nerve compression. Radiofrequency ablation uses heat generated by radio waves to interrupt the pain signals from the nerves responsible for transmitting pain from the facet joints. This procedure can provide long-lasting relief from pain originating in the facet joints. Surgery is typically considered a last resort for cervical spondylosis and is reserved for cases where conservative and minimally invasive treatments have failed to provide adequate relief or if there is significant neurological compromise. The goal of surgery is to decompress the spinal cord or nerve roots and stabilize the spine. Anterior cervical discectomy and fusion, or ACDF, is a common surgical procedure for cervical spondylosis. It involves removing the damaged disc from the front of the neck and fusing the adjacent vertebrae together using bone grafts or implants. This procedure relieves pressure on the spinal cord or nerve roots and stabilizes the spine. Cervical disc replacement is an alternative to fusion surgery that preserves motion at the treated level. It involves replacing the damaged disc with an artificial disc that allows for more natural movement. Laminectomy and foraminotomy are procedures that involve removing a portion of the lamina, or back part of the vertebra, or enlarging the foramen, which is the opening where nerve roots exit the spinal canal, to relieve pressure on the spinal cord or nerve roots. Corpectomy involves removing a portion of the vertebral body to decompress the spinal cord, followed by reconstruction and stabilization using bone grafts or implants. Posterior cervical fusion is typically performed from the back of the neck and involves fusing the vertebrae together using screws, rods, and bone grafts. Successfully managing cervical spondylosis often requires a multifaceted approach that addresses not only the physical symptoms, but also the individual's lifestyle, overall health, and personal needs. A combination of conservative treatments, minimally invasive interventions, and surgical options, when necessary, can effectively alleviate pain, improve function, and enhance quality of life. It's crucial to work closely with a qualified healthcare professional to develop a personalized treatment plan that considers your specific condition, preferences, and goals. By taking an active role in your care, understanding your options, and making informed decisions, you can navigate the complexities of cervical spondylosis and live a full and active life despite this common condition.